Good morning, my dear friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order so far discussed since last 2.5 years. And this is quite convenient for the study. I hope you will make use of it. My dear friends, since last so many classes we have been discussing about bleeding and clotting disorders. In the first part we have seen some of the basics related to the bleeding and clotting disorders and coagulation profile. Later onwards we have started with the hemophilia, and in the last class hemophilia is also completed. But today we have a special disease and very common disease and very important disease. That is also called as pseudohemophilia, and this is also called as vascular hemophilia, or commonly called as von Willbrand's disease. Von Willbrand's disease. Now, what is this von Willbrand disease? This is most common hereditary disorder, most common hereditary coagulation disorder, which is occurring due to qualitative and quantitative deficiency of von Willbrand factor. In the previous class also, in one or two instances, I have mentioned this von Willbrand factor. This is very important for two important reasons. Number one is von Willbrand factor play a vital role in platelet adhesion, which is the first part of a clotting process. And second part, von Willbrand factor is also called as factor 8 stabilizing factor. In the clotting factors cascade, factor 8, which is called as hemophilic factor, the factor 8 stabilizing factor is also the von Willbrand factor. So in the process of bleeding, in the process of coagulation, von Willbrand factor has to play two important roles in two important areas. One is initially it is helpful to platelet adhesion, which is the first step in the cascade of coagulation, and second one is in the intrinsic pathway, factor 8 stabilization. So this is a hereditary disorder. This is an autosomal dominant disorder. Autosomal dominant, when I say male and female are equally affected and there is no skipping of the generation, and basically this is related to the autosome number 12. So problem is with the autosome number 12, there is some problem. It is autosomal dominant. So if you inquire very properly, in each and every generation you will find one or two people having this particular problem. Father's family, father's generation, previous generation, grandfather's generation. If you take a proper history, then you can find somebody is suffering from a similar type of the problem. This gene is related with the production of, so why this problem is happening? This gene is related with the production of von Willbrand factor, and when this particular gene undergone mutation, either from the mother side or either from the father side, then it leads to the problem, because one gene is sufficient to cause the problem. Okay, because it's a dominant problem. So if the father or mother, anybody is having a mutant gene of chromosome number 12 related to the production of the von Willbrand factor, if it is mutant, so then there will be a definite disease, as it is a dominant trait. Okay, this is told in short, we shall discuss later. Now, so what is von Willbrand factor and what is the function? I have told already. This is a lipoprotein basically, which helps in the platelet adhesion, and also it helps in the stabilization of the factor number 8. So factor number 8 is a clotting factor which is present in the intrinsic pathway, as we know, which further activates the factor number 10. So how the von Willbrand factor work now? It stabilizes the factor number 8. Normally factor number 8, when present in the blood, it will be active for 2.4 hours. What is the meaning of this stabilization and all those things? So fact is, when factor number 8 is present in the blood, and if you are activating it, so it will be active for 2.4 hours, only for 2.4 hours. But the same factor number 8 is bound with, if it is bound with the von Willbrand factor, if same factor number 8, if it is binded with the von Willbrand factor, then its activity time will persist for more than 12 hours. Thus it enhances the function of factor 8. Okay, this is the function. Normally whenever there is a requirement of the coagulation, clotting after injury or some other issues, everything will be activated and the factor number 8 is also activated, but its time of activation is only 2.4 hours individually. But if that same factor number 8 binds with the factor Willbrand factor, von Willbrand factor, which is a lipoprotein produced from the endothelial cells, then its activity time will prolong up to 12 hours. Okay, so this is the main function of this particular factor. Now what is the difference between factor 8 and von Willbrand factor? If you want to clarify it, factor number 8, it is produced in the liver, sinusoidal endothelial cells of the liver. It can be produced from the Kupffer cell because it's a clotting factor, isn't it? And also in the tubular cells of the kidney it is produced. And whereas von Willbrand factor will be produced from producing from the endothelial cells of the artery capillaries, and also from the megakaryocytes, and also from the alpha granules of the platelets. Okay, factor number 8 is required to form the fibrin from the fibrinogen through the intrinsic pathway, whereas von Willbrand factor is responsible for two important functions. Number one is stabilization of the factor 8 and increasing the activity time of the factor number 8, and it is also required for the platelet addition. It is also required for the platelet additions. Hello? Okay. So now so let us look into the pathogenesis. Now pathogenesis is very simple. As I told earlier, hemostasis, that is coagulation. So hemostasis is a spontaneous arrest of the bleeding. If you see, hemostasis is a spontaneous process of arresting the bleeding. So there is a vessel which contains the endothelial cells, and beneath the endothelial cells there is a layer of subendothelial cells which actually contains the collagen. Over that there will be a muscle layer of the vessel, that is the tunica media, and the outermost layer is called as adventitia layer. Now there is a cut in the vessel, so there will be damage to the vessel. So in the beginning there will be constriction of the vessel, vasoconstriction, and reduction of the blood loss. We know that. And then in the subendothelial collagen we have a lot of von Willbrand factors present. When endothelial layer is damaged, the von Willbrand factors present in the subendothelial factors are exposed and released. Now the circulating platelets will bind with the von Willbrand factor which is released through the glycoprotein 1b receptors, which are located in the surface of the platelets, and this leads to the platelet adhesion. So this leads to activation of the platelets with the which express the another type of glycoprotein which is called as GP2B. This also we have discussed in detail, GP2B3A, and that will aggregate the other platelets also. GP2B3A will use the fibrinogen as cross-link to aggregate the further platelets, and this leads to platelet plug. But this platelet plug will be unstable, and this will be done by this will be made strong by factor number 8 and other clotting factors by converting this fibrinogen into fibrinin, and coagulation will be completed after the deposition of the mesh-like fibrin over the clot. Now what happens when there is deficiency in either quantity or quality of the von Willbrand factors? This factor is first needed for the platelet adhesion, and if there is no platelet adhesion, this increases the bleeding time. There is also problem in stabilization of the factor 8 and this result in increased partial thromboplast time. Because platelet number 8 is related to intrinsic pathway, so APTT will be increased. Okay, so this is required for platelet adhesions. So you will have, if it is not there, it will lead to increased bleeding time. And this is the whole process. Now there are types of von Willbrand disease, which is also called as pseudo-hemophilia. There are mainly 3 types of the disease: type 1, type 2 and type 3. Whereas type 1 is most common, it is 60 to 80%. What actually happens is there will be a partial quantitative deficiency of the von Willbrand factor. Deficiency is partial, that is not related to the quality, it is function, it is related to the quantity. Quantity itself is less. So mild to moderate level decrease in the plasma von Willbrand factor level will be seen. In this case, the production of the von Willbrand factor is normal, but amount is less. But release of its multimer in the blood is inhibited. So this leads to a mild bleeding. This leads to a mild bleeding, not always a mild bleeding. Bleeding may be prolonged to some extent, it was left unnoticed. Type 2 is quantitative abnormality. Qualitative abnormality. That is, plasma level of this factor is normal or near normal, but in spite of that, there will be a bleeding because this is not able to render the function properly. Whereas in case of type 3, there is a complete quantitative deficiency of von Willbrand factor, and the total amount of the von Willbrand factor is only 5% or less than 5%, and there is no detectable factors are present in the plasma. So severe bleeding will be there. Severe bleeding will be there, and many of the time it is also mimics the hemophilia A. Therefore, it is also called as pseudo-hemophilia. Okay, because of severe bleeding, many times it mimics this. Now there is no detectable factors. Okay, all the types of the von Willbrand disease are basically autosomal dominant type except the type 3. Type 3 is autosomal recessive. Okay, one which mimics the hemophilia, that is type 3, that is autosomal recessive, and rest of the 2 are autosomal dominant. Now in the type 2 where quality problem will be there, it is again divided into 4 types. Okay, qualitative problems: type 2A, type 2B, type 2M and type 2N. Type 2A is absence of the von Willbrand factor multimers. In the type 2B, there is hyperactive von Willbrand factor and increased affinity for the platelet GP1IB. Type 2M von Willbrand factor disease is a reduction of platelet binding function of von Willbrand factor, and type 2N is reduction in the factor 8 binding function of the von Willbrand factor. These are the subtypes. Now if you see the clinical symptoms, what are the clinical symptoms? Both male and females are affected. Then in the major cases, mild bleeding tendency will be there, nose bleeding will be there, epistaxis, particularly after the episodes of URTA, upper respiratory tract infection, and because of some amount of scratching and all, the bleeding starts. Epistaxis is there, easily bruising, tooth extraction, etc. There will be prolonged bleeding and menorrhagia in the girls. So these are the clinical symptoms. These are some of the pictures of von Willbrand disease. This is while tooth extraction, you can see. This is a easy bruising. This is epistaxis. Again the bruising. Okay. Bleeding from the umbilicus in the newborn baby. Okay, what are the lab investigation that we suggest? Bleeding time is increased usually in this condition, so go for bleeding time. APTT or PTPT, it is also increased because of factor number 8 is related to the intrinsic pathway. Then prothrombin time, that is usually quite normal because there is no much involvement of extrinsic pathway here, Okay. Plasma von Willbrand factor, if you look into that, that is decreased, or sometime it may be normal, its function may be decreased, although quantity is normal. Risocetin cofactor SA. Ristocetin cofactor SA is abnormal. Okay, so this SA is related to platelet aggregation. Now what is the treatment? Decompression acetate, that is a release of factor 8 and von Willbrand factors from the storage. This is if you give the decompression acetate, then from the store it will release factor 8 and von Willbrand factors from the storage. In the female, we can use estrogen in the form of oral contraceptive pills, which also increase the release of this factor from the storage. Severe cases, fresh frozen plasma should be given. Supplementation of the recombinant von Willbrand factor can be given. Okay, just like the supplementation of the factor, other clotting factors. So this can be also supplemented. So this is all about von Willbrand factor. Thank you very much. In the next class, we shall discuss some of the important related issues related to bleeding disorders in Ayurveda. Thank you very much.